For some Black women, giving birth can be a risky prospect. I talked to health experts about why more Black women are dying during and after childbirth.
This is what mommy is. I'm an activist.
Erica Garner was only 27 years old when she died of a massive heart attack. The activist was the daughter of Eric Garner, the Staten Island man killed by police in a banned chokehold. She had her first heart attack a short time after giving birth to her son in August. Cases like Garner's are all too common. The U.S. has the highest maternal mortality rates in the developed world. And for Black women, the risk of dying during childbirth or within about 40 days afterward are much higher. According to the CDC, Black women die of pregnancy-related issues at a rate that is more than 3 times higher than white women. And overall maternal mortality rates in Nassau County are higher than the state average. Dr. Stephanie Buck-Haskin, an OBGYN in Great Neck, says these disparities can be attributed to conditions like high blood pressure, diabetes, and obesity.
A lot of Black women are overweight, and they have undiagnosed medical problems such as hypertension. So that automatically puts them at risk.
Looking at the disparities or those differences that we see by race, ethnicity, those conditions are not enough to explain why those differences are there.
Martine Hackett is a professor at Hofstra University. Much of her research is about maternal and infant health. She says women with pre-existing conditions are at higher risk, but the effects of chronic stress on the body also contributes to this disparity.
Part of the explanation for why African American women have higher rates of both maternal mortality and infant mortality have to do with the effects of racism and how that translates into the body as stress and also as poor health outcomes.
Dr. Buck-Haskin says the best way to beat the odds is having access to health care when you're thinking about getting pregnant, throughout the course of your pregnancy, and after you give birth, so doctors can closely monitor any risk factors you may have.
When we don't find that out, we're behind the 8 ball, and we really don't have a sense until they actually deliver, and then some of these horrible things occur.
In addition to prenatal care, Hackett says acknowledging chronic stress is an important step.
Once women understand that there are also things outside of their control that also contribute to these health outcomes, they can have more power to be able to recognize that they need to be able to combat these on a larger systematic level.
If you're pregnant and can't afford health insurance, you may be eligible for the Prenatal Care Assistance Program, or PCAP. For more information, you can visit www.health.ny.gov to learn more, or you can visit our website at news12.com and click on Numbers and Links.